Once again, good afternoon. My name is Don Flattery, and I live in nearby Fairfax County, Virginia. Like so many of you in attendance today, I've been impacted by the death, in deference to Barbara's comment, of a loved one to the epidemic of opioid addiction that has stricken our country, having lost one of the most precious things in my life, my 26-year-old and only son, Kevin, to an opioid overdose 1 year, 33 days, and approximately 11 hours ago. I've been asked to speak with you today not to convey how painful the losses to the nation's opioid addiction epidemic are to America's families. Many of you already know that. You've suffered the same wound, one that cannot be adequately described in our rich English language in a 5-minute conversation from a stage in Washington, D.C. My primary goal in speaking today is to bring to you some additional perspective born out of my own son's treatment experience about one slice of this issue, one aspect of the epidemic of opioid addiction that must change, and one in which I see some hope on the horizon. Specifically, the wider use of medications that block the effects of opioid drugs, reduce cravings, and allow patients to address concurrent issues which may be contributing to their substance use disorder. Medication-assisted treatment, or MAT, is clearly beginning to show promise for recovery. Thank you. I'll not do a deep dive into my son's journey. There are echoes of his path that many of you out there would recognize in your own loved one's story. The details might be slightly different, but we share the same end result. Let me just say that my son enjoyed the blessings of a Washington, D.C. life, attending parochial schools, participating in high school athletics, and was a good student in high school, a loving son, and a good brother. He graduated from a very fine university in 2010. My Kevin came to his addiction as a young working adult, pursuing his passion for film and editing and writing in Hollywood and New York City. He'd been battling and was being treated for issues related to anxiety attacks, stress, depression, and starting in 2013, after self-medicating with the opioid prescription drug OxyContin, was being treated for dependence and then addiction. He bravely returned home to Northern Virginia in the fall of 2013, seeking treatment and our support. He was working hard with our help to conquer his disease. Like many struggling with opioid addiction, he tried a variety of treatment and recovery options, including inpatient detoxification, intensive outpatient, a regimen of buprenorphine, STEP program support, and 28-day abstinence-only residential program. But like many others in pursuit of recovery, he experienced the all too common cycle of seeming progress and relapse. Days before he was due to start a course of treatment with extended release naltrexone, or Vivitrol as many of you know it, he relapsed again and did not recover. Since my son's death, I've learned a great deal more about the disease of addiction, its underlying causes, and painfully for me and my family, some evidence-based treatment opportunities involving several medication options that offer hope, but now only for others. The most significant lesson learned relates to attitudes about and approaches to the use of medication-assisted treatment. My son was confronted at some STEP program meetings, and he attended many different meetings where he faced judgment and pressure about his use of buprenorphine. He was made to feel he was not really in recovery, not serious about his sobriety, and substituting one addiction for another. All false, mind you, but terribly damaging to him nonetheless. I hope all of you will agree that under no circumstances should anyone with an already impaired sense of self-esteem be subjected to such judgment and stigma by others in recovery. Simply when they are trying to find a supportive environment. This shoot the wounded attitude must stop. When my son applied to attend a well-known abstinence-only residential treatment facility, he was told by them he would have to taper off his buprenorphine, done in 1 week's time, which is completely counter to current medical thinking. He was conflicted. We were conflicted. We didn't know better. While at the residential treatment facility, he was faced with a program focus that included lectures about discipline, self-control, and appealing to a higher power to cure his disease. Few, if any, other diseases are treated in this way. We do not instruct patients with diabetes who may not have the discipline to change their eating and exercise habits to forego their insulin medication. Medication, like MAT medications, that stabilize their conditions and keep them alive. 64 days after leaving the abstinence-only residential facility and being released to the wild, in my opinion, without his MAT support, my son succumbed to an overdose. As many in this audience know, it's a well-documented fact that the afflicted, detoxed, or immediately removed from their MAT support at that moment are at their highest risk for a fatal overdose, even with a dose that previously would barely affect them. Now, let me be perfectly clear. I'm not suggesting that the use of medically assisted treatment is the only pathway to recovery. For those of you out there, and there are many of you, who have regained your lives through an abstinence-only approach, I say congratulations. I applaud your dedication to the recovery path that seemingly is working for you. What I am suggesting is that the current evidence shows that medication assistance, coupled with individual therapeutic assessment and support group mechanisms, are showing greater results for recovery than simply abstinence-based approaches. And that those who choose this path should never be judged, harassed, or stigmatized for choosing what they and their doctor believe gives them the best chance of recovery. The evidence is in. The earth is not flat. Measles vaccines do not cause autism. And MAT application with other behavioral support is showing greater recovery success than abstinence alone. Now, earlier I said I'm seeing some hope. I'm seeing changes happening and positive steps being taken to support evidence-based approaches that will result, I believe, in MAT support becoming the new standard of care for treatment of opioid addiction. I see it in the Office of the National Drug Control Policy's new directive to deny drug-free community grants to states whose drug courts shamefully force their participants to taper off MAT medications. I'm seeing it in HHS Secretary Burwell's recent announcement to take steps to raise the cap on the number of patients physicians may treat with buprenorphine. I'm seeing it in changes to the Substance Abuse and Mental Health Administration's treatment grant program, which encourages states to follow with federal grant money, to support those with federal grant money, those who follow evidence-based approaches, specifically MAT. And just last week, the Association of Addiction Medicine released a new national practice guide for physicians to treat more effectively opioid-addicted patients with medication assistance. That is a great new tool in treatment. Finally, I'm seeing positive changes in treatment by some private treatment providers, like Phoenix House, and more recently, Hazelden Betty Ford, which now is willing to treat those with opioid addiction on a variety of tracks, including one for those attending and using MAT medications. Phoenix House and Hazelden Betty Ford, unlike some private treatment providers who do not believe, and this is a quote from one of those private treatment providers out there, that Suboxone allows people to avoid experiencing the full effects of withdrawal. That's a pretty shameful statement. As if those afflicted with opioid addiction, who know intimately the pain and misery involved in experiencing withdrawal, must somehow be forced to have their suffering intensified to make the experience more real. That kind of attitude must end. The changes I've referred to in attitude and in approach will provide those afflicted with opioid addiction treatment options that reflect 2015 evidence and knowledge, and not treatment or recovery approaches that may have been effective for other forms of addiction from decades past. Medication-assisted treatment allows patients to stabilize and to return to normal rhythms of their lives with reduced cravings, less pain, and discomfort. It's treatment that works, and it's treatment that today's opioid-addicted patients deserve. It's time to improve their chances for successful recovery by embracing this form of treatment. Thank you for listening to me today. Thank you.